Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I'm speaking with Dr. Bin Chao, Vice President and Director of Respiratory and Critical Care Medicine at the China-Japan Friendship Hospital in Beijing. Dr. Chao has been working in Wuhan, China, responding to COVID-19 for the past 2 months. In this interview, he speaks about how the situation has changed in Wuhan over this last 2 months, about protecting healthcare workers from infection, about the risk factors for death from COVID-19 in Wuhan, and about ongoing research to identify treatments. Let's listen. Dr. Chao, thank you very much for joining me today from Wuhan, China. How are you doing today?
Fine.
Great. So let me just make sure I understand. You usually work in Beijing.
Yeah.
But for the last 2 months, you have been in Wuhan, both taking care of patients and doing research. Is that correct?
Yeah, correct.
And what is the situation now in Wuhan with respect to the novel coronavirus?
Yes, there's a very few newly onset of COVID-19 cases, but one month ago, that the situation is very different.
What was it like when you got there to Wuhan?
You mean that on the first day, right?
Yes.
Firstly, when we came to Wuhan, there are many cases, and the and Wuhan city opened new hospitals to enroll the many cases. And during the last month, yes, most of the patients recovered and discharged from the hospitals. So the good news that during the last one week, there are very few newly onset of the COVID-19 cases. And I'm happy, yes, to anticipate the normal life of the general population.
Well, that's very, very good news. While you have been there, I'm sure you have seen many things. Right now, we have cities in the United States that are thinking about what could happen in the United States. Based on your experience, do you have particular advice about how serious this problem can get?
Yes, I think several days ago, the WHO General Secretary in the TV show that he mentioned that what's the priority that every country should pay enough attention, yes, to the situation. I think it is the most important. Another thing is very clear that it is one kind of respiratory tract infection, and the disease can be transmitted from person to person.
And tell me about the challenges or what has been done to protect healthcare workers in the hospital that you are working in Wuhan. What's been the most important to protect healthcare workers?
I think it is not the most difficult for healthcare workers. The prevention of the nosocomial infection. The doctors or nurses have the protective equipment, such as the mask and the protective clothing.
Mm-hmm.
I think there's no worry about to be infected in hospitals.
And I mean, we've read that initially there were a lot of healthcare workers infected in Wuhan.
So this is a lesson that the American doctors and American nurses should learn from China side. Yes, in the beginning, yes, because of that, in some hospitals, the doctors and nurses did not pay enough attention to the disease. But
I see. Before they really knew what was going on.
I think it's a lesson. Yeah. So I think the lesson, the Chinese doctors have gained. Yes, 1 or 2 months ago. So I do not want American doctors have the same lesson. Yeah, if you
Right.
realize that is a disease, it's a transmittable disease, you will have find a way, yes, to prevent nosocomial infection. But if not, if you do not think it's a new disease, you will suffer.
At
Yeah, yeah,
risk.
right.
Yes, that's a risky
Yeah, yeah.
situation. So now I understand you've been leading some research projects in the hospital there. You recently published a paper in Lancet. Could you tell us the main finding of your paper?
Yes, yes. We have two papers published in Lancet, yeah, during the last month. First paper was published in January 24th on the eve of a Chinese traditional holiday, the Spring Festival. So the second paper was published 2 days ago. Um, yes, yes, I have said that it's a new disease. So if we want to know the new disease, we have to spend time. It takes time for clinicians to learn the new disease. The the two papers are two steps of the clinicians get to know the disease. The first step is that it's just like a portrait of a disease. So it's not very clear that we only figure out that what the disease looks like, just as you look yourself in the mirror in a long distance. So you cannot figure out how. And I think the most priority of the first paper is that we tell the world that is a disease caused by a new coronavirus. So this
Right.
is a finding.
That was a very, very important
Yeah.
paper. And what about the
The
second
second
paper?
paper is that we go more detailed to the disease, which means that we closely monitor the progress of the disease from the onset of illness to the end. So the end means that the discharge or death. So during the whole course, we we have the close observation of the disease, such as how many days the fever will last, how many days of the cough will last, and what the percentage of patients still suffer from cough on the day of discharge, and and what
Right.
the change of the symptoms, such as if the patient recovered from fever but he had new onset of dyspnea or even short in the breath. A part of them may even develop ARDS even after they have recovered from fever. So this is a novel.
So I see. That's lung failure. That's a very serious problem. Even after they've recovered from fever, their lungs can
Yeah,
fail.
you're right.
Let me ask you this. There's been some questions that have come up about whether people who recover may be left with permanent lung disease of one kind or another. Is that covered in your paper? Do you have a view on that topic? Pulmonary fibrosis, for example, or other lung conditions, even if they recover.
Yeah, but yeah, maybe next paper. Yeah, but not in this paper. And another finding of this paper is that we find the risk factors for death. And in this paper, we have three main findings. First is the age. It seems that the elderly patients will die from the disease more easily compared with the young patients. And second is that we find the SOFA score. SOFA score is a marker for sepsis. And in this paper, we mentioned that yeah, previously, yes, sepsis usually mean the bacterial infection and bacteremia. But in this situation, we prove that the sepsis may be only due to virus, the coronavirus.
I see.
Yeah, it's a new concept. Yes, we have the same situation of the patients has only new coronavirus infection, but no co-infection with bacteria. So this is our
Wow.
another novel finding of this paper. And third is that we find that the increased D-dimer will be a good marker to predict the death of the patient.
I see. That's a blood test that can be done.
And the reader, yes, send me email, ask the same question that he's a faculty of a university, and his question is that, Dr. Cao, can you explain that why the dimer is a good predictor for death? Here is his answer that you mean that the virus can bind to the cells of the human beings by the receptor of ACE2. And there are a lot of ACE2 receptors on the alveolar epithelium. This is the top level of the cells. Another cell type is the endocytes of blood vessels. So
I see.
it seems that the virus can firstly invade the lung, and from the lung to spread to the blood, and as soon as the virus spread into the blood vessel, the virus will bind to the endocytes
I
of
see.
the
That's one of the cells in the blood vessels, and then it can even
yeah,
replicate there.
damage the endocytes. As soon as there's a damage of endocyte, there will be clots,
I see.
and the clots will be everywhere, all the body.
Clots, yes.
Clots.
And that can really put somebody at risk for death right there when that happens. Let me ask you about treatment. What has been the most successful treatment, and what kind of research studies are underway right now to find even more successful treatments?
Yeah, I think it's both an easy question and a difficult question. The easy question is that it's an infectious disease. It's an infectious disease caused by virus. So the easy answer is that we should use antivirals. So it's an easy question. A difficult question is that how can we find an effective and safe antivirus? So at this time, yes, our team are leading 3 clinical trials of antivirus to COVID-19. The first trial is the clinical trial, lopinavir and ritonavir. And this trial we have successfully completed, and our paper is under review. So I think all the audience will read our paper.
Great.
Yeah, maybe next week or in 2 weeks. Yeah,
Okay.
yeah. After that, we have been leading 2 remdesivir trials, remdesivir 1 and remdesivir 2. Remdesivir 1 focus on mild to moderate pneumonia cases, and remdesivir 2 for the severe and critical cases. Both remdesivir trials are moving forward. I think maybe the remdesivir 2 for severe and critical cases is faster compared with mild to moderate cases. So yeah,
Okay.
maybe I think the audience will read our paper next month in
Okay.
April. So as soon as we
And there's another trial, a third trial too?
yeah, there are one lopinavir trial and 2 remdesivir trial.
Oh,
Yeah,
got it.
yeah,
Okay.
Yeah. So I think it is the Chinese physicians' tradition contribution, yes, to the international society, and
It's going to be extremely important. Those studies will be extremely important. Is anybody thinking about using antibodies from patients who have recovered as a treatment?
yeah, it's another trial. Yes, we are conducting now. Yes, yes, you mentioned the convalescent plasma trial, and we have also registered in our local registration website. And yeah, at that time, yes, we have tested no more than 100 patients. So I cannot tell you what the effects and but it seems at least that the convalescent plasma is safe in our clinical trials. So yeah, maybe I think maybe is a option, yes, for treatment of, but in our trial,
But we'll have to see the data and whether people get better.
yeah,
right?
yeah,
We'll,
we
we'll
do.
have to see
Yeah,
the study.
Yeah. But we in
Well-
our trial we only tested severe or critical cases, so we have no data for mild moderate cases.
I see, for the plasma at this point.
Yeah.
Well, this is extremely helpful, important information. I want to thank you for spending time with us and for all that you are doing for the people of Wuhan over the last 2 months, starting when it was obviously very difficult and now when the number of cases has dropped considerably. And thank you for the information and the lessons for the United States and other countries around the world. And I really wish you the best in all the work that you're doing to identify treatments for patients with COVID-19.
Thank you.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamari Morales. Audio production by Niall Owen McCusker with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.